Hello and welcome back to our second video in the two-part conversation we're having with Moondust Cosmetics primary biochemist and cancer researcher, Dr. Moondust. It began with the publication of a chapter she wrote in a medical text for students of clinical oncology based on her work as a cancer biologist. So let's continue that discussion. Welcome back with us, Dr. Moondust.
Thank you.
I guess now we'll try going back to the resveratrol because there's a great deal to be said about it and your history with it.
Okay, so just to review some studies with resveratrol. The earliest studies with resveratrol were conducted in a chemical skin carcinogenesis model with mice and with the initiator and promoter. And it was found that treatment with resveratrol decreased the tumor incidence, size, and number. So that was a very good result. And actually, there's a human corollary to this in that some people, as we've discussed before, burn in the sun because of their genetics. And some people tan. And the people who burn, UV light can act as a complete carcinogen in that it can cause skin cancer in them. Whereas the people who tan, they can get skin cancer in another way. The UV light can act as an incomplete carcinogen, but if they put on suntan oils, apply suntan lotion before they go into the sun, some of them have tumor promoters in them. And so that's another way of getting skin cancer.
Wow, in the suntan lotion that is meant to protect us, that we're buying to protect us. That's scary.
That is very scary, and I'm not sure why the FDA allows this to continue, but it's not good.
Now, Dr. Moondust, you had mentioned something about other studies with topical resveratrol treatments that reduced cancer, reduced tumors.
Yes, so the first study was also with topical application. And so now it's very interesting. Scientists have developed mouse models that mirror this situation in humans. So you have the mouse model with the initiator and promoter, the two chemicals. And they've also developed mice that get sunburned once they're exposed to sunlight or UV light. And then they develop skin tumors. So the experiments with resveratrol have shown that also in this type of mouse model, that the topical application of resveratrol can inhibit the development of the tumors. And it does this by selectively killing the pre-malignant and malignant cancer cells.
Wow, that's very encouraging about the resveratrol, but I'm just a little bit confused. I wonder if you can clarify, because we've been talking about apoptosis or cell death, and you're saying it can cause skin cancer, and then there's also that detail about resveratrol causing cell death. So I wonder if you could clarify that.
Okay. So the key here, Helena, is that resveratrol is causing selective cell death in cancer cells. It's not affecting the normal cells at all. Whereas once you're exposed to a carcinogen, it can cause cell death in normal and abnormal cells. So, it's two different things, and that's how you're developing cancer, is because it's killing your normal cells, the carcinogen, but not the resveratrol.
And we're always thinking in terms of, the results on humans. And now you've also mentioned about the mouse trials, the animal trials. I wonder if you can speak more about that. If we're getting the kind of results, we're obtaining results that are useful or comparable.
Right. So really, scientists are interested in the results in humans.
Right.
And personally, I've always worked with human cultured cells or human models.
Mm-hmm.
I've not worked with animal models myself.
And it sounds like that's actually something that's of personal importance to you.
Yes, it
About
also
not working.
has both scientific and personal and ethical importance to me because I'm a vegetarian as well. So the experiments I did were on myself, and I'm a person who's very susceptible to sunburn, especially in the summer months. And so the experiment I decided to do was to, in a controlled way, expose myself to the summer sun for limited periods and see what would happen, because I had no idea what would happen. That's how the experiment started. And so I had repeated sunburn on my nose, and it kept peeling as a result of the sunburn, which is apoptosis, which is cell death, as we've discussed.
Right. That's very evident cell death. We can see it on our faces, like as plain as the nose on your face.
Right. The peeling. So then after 3 months, when the summer was over, I had developed a lesion on my nose where it had continually peeled. And then after 8 months, it developed into a tumor, and the definition of tumor is an abnormal growth. So it was abnormal growth on my nose. So then this was really quite interesting to me, and now I could try out the resveratrol. So I made a resveratrol ointment with 50 milligrams per mil in an aloe vase, and I applied it daily, and within 10 days, I saw regression of the abnormal growth on my nose. And after that, I was continually applying all the time a Moondust Cosmetics sunscreen, which had zinc oxide and bee propolis in it. And we discussed bee propolis in the earlier video, that it also has some anti-proliferative, possibly anti-cancer properties. So it's possible that both these things, the resveratrol and then the bee propolis in the sunscreen, together caused complete remission of this abnormal growth on my nose.
I'm heartened to hear about the natural ingredients that you experimented with on yourself, and that's courageous. And you observed in yourself, and also that what is part of the formulation of Moondust product, Skin Protector Plus. So I'm very heartened to hear about the natural ingredients and also to hear about the results. Now, I've seen some of those close-up photos of noses and facial skin on the website. Now I know where some of those photos came from. They were part of your evidence and observations in your experiment where you used yourself as a test subject. So I wonder what we can gather from this. Like, what does this mean for us about the malignancies and the growth on your nose?
Okay, so although it was never demonstrated that this abnormal growth or tumor was malignant, what it does demonstrate is that this application of resveratrol may be an effective chemopreventive post-sun exposure strategy in people who
Mm.
are highly susceptible to sunburn and therefore to skin cancer.
Mhm. Now, is that where the SPP fits in, the skin protective factor that Moondust produces?
Right, so Skin Protector Plus, SPP, um, and all our Moondust products actually block apoptosis. They prevent apoptosis, the cell death, which is directly linked to skin cancer. So that's the
Mhm.
importance of wearing the various skin protection that we offer.
Skin protection. Mhm, mhm. I wonder, Dr. Moondust, if in your work with cancer patients, you've recommended resveratrol directly to any of the cancer patients.
Yes, I have recommended a combination of resveratrol and matcha, which is a green tea powder,
Mm-hmm.
to a few cancer patients, always with positive results. But if you are undergoing chemotherapy, you should always consult with your
Of course.
oncologist, whatever you're going to take, supplements or whatever.
Yes. Again, very familiar to us. We've become accustomed to hearing about resveratrol because we've been encouraged in the media to have a glass of wine, to have some chocolate, and to dip into that peanut butter and feel a lot less guilt and expect some health benefits while we're having the delicious ingredients in life. So I'm wondering, though, about the you know, the, the actual dosages, like what is the average daily dose of resveratrol? I'm wondering how
Okay,
much
so
should someone ingest for
here's the
benefits?
bottle of, I don't know if you can see that, it doesn't seem to be,
Oh, there it is. Yeah,
resveratrol.
right in the center. If you put it right in the center.
And it's 250 milligrams,
Mm-hmm.
which is an average daily dose.
Uh-huh.
And as far as the green tea, the matcha goes, I always say drink as much as you can. And, these are both totally natural supplements and they're very safe. They're like any other supplements you might take, vitamins or minerals or something. And these days, with medical professionals so focused on COVID-19 and the coronavirus, I'm concerned that cancer patients may not be getting the medical attention they really need. So
Mm-hmm.
these are two things you can take that are totally safe and might even offer some kind of benefit um,
Mm-hmm.
to you. They certainly will offer other health benefits. They
Mm-hmm.
may or may not offer benefits as far as the cancer is concerned.
Mm-hmm.
There is a notable exception, though. People with
Okay.
multiple myeloma,
Mm-hmm.
they should not take resveratrol. And prostate carcinoma patients, they may find that procyanidins are more effective than resveratrol, although there have also been positive results with resveratrol.
Mm-hmm. Mm-hmm. Well, I'm on board with you on the edibles, the things that I can control immediately, as I said, with the very next meal. Thank you so much for your points of interest. Of course, the simplest one for me, and I'm sure many people to take away, is again the food we put into our body. I'm on board with you with the chocolates, with all of the different berries. I think my research way back showed that there's only 5 milligrams of resveratrol in a glass of wine, so I think I'll hold the wine and go for the matcha tea. Thank you very much for introducing the natural elements that we can help ourselves with, as well as the benefits of resveratrol in a um, medically supervised situation. So we now know that it's like a natural supplement that we might add to our health regimen, like our vitamins and our minerals. And we've learned about your policy of compassion and ethics in your laboratory regarding animal testing. Thank you for informing us of that. I think that would be very important to a number of people. So we've certainly added to our knowledge. I thank you very much about apoptosis and your central work in cancer studies. Thank you very much for linking it to our daily health care that we normally talk about on the Moondust Cosmetics website with Skin Protector Plus. So thank you, and I hope that our viewers will follow us on social media and visit our website for the full text of this interview and other articles you'll find of interest on science and the art of sun care and skin protection. Thank you for joining us today.